So good afternoon, everyone. My name is Drudi. I'm a chief resident at McGill University in Montreal, Quebec, Canada. And this is our first trainee-to-trainee interview through the Vascular and Endovascular Surgery Society. And the purpose of this interview is really to get a sense of a trainee's perspective in a hot zone of the COVID-19 pandemic. And we are so happy to have Dr. James Cornwall here with us today. I'd like to first thank my colleague, Dr. Linda Wang, who's also a chief resident at the Massachusetts General Hospital, in setting up this interview. So we'll go ahead and start. James, how about you tell us a little bit about yourself?
Hi, so my name is James Cornwall. I'm one of the fifth-year residents in the Integrated Vascular Surgery Residency Program at Mount Sinai Hospital in New York City.
Great. And can you tell us how you and your colleagues were first notified about the COVID-19 situation and the pandemic, and how it evolved to your center?
I mean, I think a lot of us had been following sort of the progression of it, in January and February and throughout. But I think really when it first affected us, or we first really noticed it, was when they started having travel restrictions on hospital employees for academic and educational purposes, as well as some restrictions on personal travel. And then all within a week's period of time, there was a cancellation of one of the vascular surgery conferences in California. And then there was a full restriction on all elective cases. And that all happened sort of around the same time within a 1 week period. And that's
And over the past month, can you take us through what has happened at your center?
Yeah, so it was about 5 weeks ago, as I was saying, when they stopped all elective cases. So that's a huge part of what we do.
Right.
All of the outpatient visits, all office hours, were stopped. And so really, as far as the OR goes, we're really only doing life or limb-threatening cases. And then the surgical services themselves have been really reduced to just bare bone numbers. So everyone else has now been, assigned to one of these COVID units.
Okay. And how many people are on service now within your group?
So within our group, there is, 1 or 2 chief residents on, and then, there's a rotating group of interns.
Okay. And how pardon me?
Sorry, it was all the other senior residents have been assigned to these or deployed on these COVID teams.
I see. Okay. And how has your call schedule changed?
The call schedule, it's it's still the same. I mean, you still have a few days a week where you take call, and then there's still 1 attending on call for that whole week.
Okay. And you already mentioned that there were a variety of redeployments with a lot of trainees sort of facing redeployment. It's on a lot of people's minds. So have you been faced with redeployment to another specialty?
So I have not. I'm part of the bare bones group that's still on the vascular surgery service.
Okay.
However, all the other senior residents have been assigned to these teams, and the teams consist of an attending surgeon, a senior surgical resident, and then a PA, NP, or an administrator. And they are sort of reassigned to the places that need it the most within the health system. So that is almost entirely emergency rooms and ICUs throughout the health system. So we have hospitals all across the metropolitan area.
Okay. And have you and your colleagues received additional training on the use of personal protective equipment, or any specific training to deal with a COVID-19 patient that might need a surgery, for instance?
Yeah, so the anesthesia department at Mount Sinai has offered 2 excellent courses for all hospital employees that want. One of the courses is on the proper use of PPE, so sort of what that looks like and what that entails. And then the other one is sort of a crash course on critical care for patients with COVID, and sort of some of the data and some of the evidence and some of the best practices that they've formulated.
Okay. And have you needed to operate on a COVID patient yet?
Yeah, we've operated on a fair amount of patients who've been COVID positive. And it's the big things is having a COVID test on all patients that are going to the operating room.
Mhm.
If they don't have time to wait for results to come back, then
Right,
they're presumed positive. So this is being very thorough with PPE from the moment you're transporting the patient to the operating room till when they get to the operating room. Having a good plan for what the anesthetic modality is going to be preoperatively, because obviously we prefer to avoid having to intubate these patients, then also having to avoid intubating them unexpectedly in the middle of the
correct,
operation.
yeah,
We keep the same team as far as nursing, anesthesia, and obviously surgeons throughout the entire case. There's no one going in and out. There's a nurse who's designated a runner who's outside of the operating room, who, if they need any supplies or any equipment, they just tell that person and they go and come back, so they don't have to, you know, keep, using up PPE and exposing themselves. And then for the intubation, the anesthesiologist is alone in the room for the intubation process.
okay. And is there a delay between the intubation and going in to do surgery? Some hospitals have instituted like a 15-minute delay before starting, given the situation.
Yeah, I've heard about 15 minutes to half an hour delay.
Okay, right. And as you've also mentioned, there's been like a significant decrease in the number of vascular cases we as trainees are performing. Can you give us just a sense of how senior trainees, particularly ones graduating come June, how are they reacting to this decrease in case volume? And are there concerns about meeting certain competencies to graduate?
So we have 3 graduating trainees this year. So it's the 2 fifth-year residents, of which I'm one, and then we have 1 second-year vascular surgery fellow. We've all met our minimum requirements from the ACGME, so I don't think there's any concern in that regard.
Right,
Obviously, we would, prefer to have a busy elective, operating schedule for the last 3.5 months of training, but that's not the reality of the situation. And I think honestly, given the cost that so many other people have had to pay,
right.
if this is the worst thing that happens, then I'm incredibly lucky. So.
And have you been involved in outpatient clinics using telemedicine? Has your hospital used the telemedicine, and if so, in what capacity?
I know that they are using a lot of telemedicine. I have not personally been involved, but I know that keeping patients from coming to the emergency room is a really big part of the strategy for addressing this pandemic. So I know that there are a lot of people who are implementing telemedicine throughout the hospital. The only things I've seen are patients sending pictures of wounds via email to the attendings, but I think that happens regardless of what's going on in the world.
Great. And with schools and daycares closing, are there certain residents at your institution with families? How are they coping with the situation? And what are resources that are being provided by your institution to assist with residents or trainees who have families?
Yeah. So I think for people who have families, I think oftentimes if the spouse is working, then it's more than likely that they're currently working from home.
Right.
So that does make it incredibly stressful if you have a child who's school aged and school's canceled and they're at home. But that's that does help with some of those issues.
Mm-hmm. And do you find that there are certain trainees, given that they have families at home, how are they coping with working in the hospitals? Are they self-isolating from their families, or do they have certain procedures that they sort of undertake before going home?
Yeah, so it's a big conversation amongst the residents is whether or not we're gonna isolate from our, from our significant other or spouse.
Mm-hmm.
It's New York City, so real estate isn't readily available all the time. But I think people are way more thoughtful about not, obviously not wearing, scrubs at home, always changing clothes. Everyone has a routine when they get home, everything's off, they run in the shower. I know that most people, I think their biggest concern is their parents, because I think almost all of our parents are, above the age of 60 and they're really in a high
Right.
risk group. So I think that was sort of all of our major priority at the time.
And are they self-quarantining or isolating from their families over 60?
Yeah.
Yeah,
I think
for the
most
most part.
most people that have the ability to do so are doing so.
Will do so.
Yeah.
And have you gotten a sense, of probably very difficult to say at this stage, from your program or from the hospital, if things might start returning to normal over the next few weeks?
No.
No.
Everything I've heard is all speculation.
Right.
So, it's hope for the best and prepare for the worst.
Exactly. And where are you on the curve? Do you have a sense of that?
Not anything that I've heard directly from the hospital. All I know is what I've read about in the news, and it seems as though I think the Governor Cuomo today made a comment that we're sort of past the worst of it. But
All right.
but
Well, that's a little hopeful.
Yes.
And finally, and this is probably a big question, but how has overall well-being and morale been in your group amongst the trainees? And are there tools or resources they're tapping into to address their own mental health and well-being during this pandemic?
Yeah. So I'd start off by saying morale is strong. And I know that the hospital has increased a lot of the resources available for, mental health and well-being. But, even it's really every level in which that's taking place. The program director, the chief of the division, even the chair of surgery are reaching out, checking up on people, making sure everyone's doing well. Amongst the residents, we all check up on each other. We're always, talking, even if we can't be, physically with one another. We'll have, Zoom happy hours, Zoom meetings where we can all hang out and catch up and kind of, get an idea for what everyone's going through.
Yeah.
I think that's, those are things we've been doing all throughout residency for any, but in this case, it's quite helpful.
Perfect. So I wanted to thank you so much, James, for giving us a little bit of insight into what you've been going through. Are there any other things you want to let us know? Things on the front line that you've been experiencing that we haven't really spoken about?
Yeah, it's being spoken about a little bit more, but I just to sort of reemphasize how many of these patients are having arterial and venous thrombotic events. It's even if they have no other predisposing risk factors for vascular disease, we have seen just a lot of cases, and we have actually been operating a fair amount on these patients. And the health system actually now has a protocol on anticoagulation for all these patients, and virtually, if they're high risk or moderate risk, they're almost all getting therapeutic anticoagulation during their hospitalization and then going home on some sort of oral anticoagulant. So I think that's definitely something that we're seeing. We weren't expecting to see, and it's definitely impacted.
Yeah, and I think those are trends that many vascular surgeons across the country and the world are actually seeing. Is there a specific threshold where you start anticoagulation? I know there's guidelines aren't out yet, but I'm sure they're on their way. But are you just starting full anticoagulation on everyone, or do they need to meet certain requirements?
So there's a whole algorithm that the hospital has sent out and uses for anticoagulation, but it is virtually everyone who is they send off D-dimers and they look at some inflammatory markers and so on and so forth to help kind of risk stratify. Right. But for the most part, all these patients are getting some degree of anticoagulation.
And is that helping their whole clinical picture?
I don't know if we have enough
data to support that yet.
To support that, but we do see these embolic events in patients who otherwise we weren't seeing them in before this whole pandemic started. So.
Okay. Very interesting. Well, I think there certainly will be more that will come out in the literature over these next coming weeks and months concerning that. And you might be involved in that.
Absolutely.
Well, thank you so much once again for agreeing and volunteering to be interviewed for this first trainee to trainee interview with the VESS. And I want to wish you all the very best on the front lines. And I hope you stay safe.
Well, thank you very much. It was a pleasure. Well.
Thank you.